embracing change and evolving lives. Liza Boubari is your expert in women's wellness and personal growth, offering practical tips to break emotional blocks, reset limiting beliefs, and take control of your life. With over 20 years of experience, Liza delivers actionable guidance to help you navigate challenges, break old patterns, and thrive, empowering you to face life with confidence and clarity. You'll leave each show with real tools to transform your mindset and your life. Ready to take the next step? Call 818-221-2797 or visit realtalk870.com to connect. And now, your host, Liza Boubari.
Greetings, 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 and welcome to Real Talk with Liza, where we make an impact with one conversation at a time. It's so good to be here with you, isn't it? Tonight is absolutely wonderful. I am truly excited because I walked into the station, and I've been talking about dreams become a reality. I walk into the station and I've got my banner. It is absolutely exciting because, as a little girl, I always wanted to be on the radio and make an impact. And I hope each and every segment is making a difference in your well-being, in your mental health, and also physically, mentally, and emotionally. Tonight, it is more exciting because instead of one guest, I have two guests. I have Christeil Gota, which is a friend, a colleague, a client, my best friend. And today I have a special guest also. Someone whose brilliance shines not only in her academic background, but in her whole person approach in healing. Please welcome Dr. Cristal Speller, Stanford educated medical doctor, integrative wellness expert, and fierce advocate for functional and regenerative medicine for women. Welcome, Dr. Speller.
Thanks for having me.
Of course. So in a moment, I'm also going to invite Christeil to join us. But for now, we're going to have some chat. Okay? So Dr. Speller, your academic path is so impressive. Stanford, UC Berkeley, Children's Hospital in Oakland. But then you pivoted. What inspired you to shift from traditional pediatrics to integrative and functional medicine right here in Glendale?
Okay, so that's a bit of a story.
Okay. This is what Real Talk with
Right.
Liza is all about.
So after I finished my my residency in pediatrics, I practiced general pediatrics for a while. And honestly, even very early on, I was a little discouraged by what was happening in general pediatrics. I didn't like what I considered to be excessive use of antibiotics, and I didn't feel that great about what was happening with the immunization schedule. And I just wasn't sure what I wanted to do. So I decided to take a little bit of time off, and during my what I call sabbatical, I became involved in cannabis medicine.
Oh.
And it was fascinating to me. I didn't know much about cannabis before starting, except that I believed that it did have medicinal benefits. And I was able to help patients get off of medications, lots of side effects. I could get them from maybe 10 medications down to 3 medications by using cannabis for their chronic pain, for anxiety, for sleep, for PTSD. And it was during my time as a cannabis physician that I became more interested in holistic medicine.
Okay.
Because I did have plenty of patients who asked what else they could do besides cannabis, and I wasn't really sure, so I had to educate myself.
Okay.
So
how long ago was this?
That was in probably 2004.
Okay.
And so then I just embarked on a journey of educating myself about different forms of holistic medicine. including clinical homeopathy,
Right.
Ayurvedic medicine.
Yes.
I ended up doing a fellowship in integrative medicine at Dr. Andrew Weil's Center for Integrative Medicine in the University of Arizona.
Arizona.
And it was during that fellowship where I was introduced to functional medicine.
Okay.
And I thought, this is it. Okay. This really makes sense.
Okay.
And I'm not sure I'm sure you know, but maybe many of your listeners are not aware of what functional medicine is.
Well, we're going to go into
Right.
that because one of the things I wanted to know, was there a defining moment that of a personal health, your own, that shifted or challenged, that opened the door for you to even go from medical to cannabis and from cannabis to integrative, or was it just an interest?
It was just an evolving interest,
Okay.
with all of the information I was accumulating through all of my studies.
Okay, so it was not something that you were introduced and they treated you and you said, this is what I want to learn, or, okay.
No, luckily, I haven't had any significant health challenges.
Beautiful.
So, yeah, no, that wasn't it. It was just really just learning more and until something just clicked.
Okay. So what resistance or surprise did you encounter from maybe your peers when you made this shift?
Well, there were lots of questions,
Okay.
from my former Stanford colleagues and, other allopathic physicians that I'd meet. Just a lot of them just couldn't understand what I was doing. And so, I had to find a new community, and that's what I did.
So the work that I do as a clinical hypnotherapist and tapping into the subconscious mind and everything, you went from treating symptoms to treating a whole person, the person as a whole.
Absolutely.
Okay. All right. Now, when you're talking about this, first of all, I have been to your office. You have a very nice office right here in Glendale.
Thank you.
When did you start your office right here?
Well, this office in Glendale, I took over from another physician who had a weight loss practice. That was
Okay.
in 2018. And then after taking it over, I transitioned it to a functional medicine practice.
Okay, because I know you also treat weight.
I do.
Okay.
Right.
I do the emotional aspect of the weight. It's not what you eat, it's what's eating at you. So we tap into peeling away the layers and layers of what are we holding on to, what you put on. What makes an approach, because many people hear the term functional medicine or integrative care, and yet we don't really understand what it is. Could you please emphasize and elaborate on that one?
Okay, sure. First, I'd like to start by defining what conventional medicine is, in this
Okay.
country. So conventional medicine is also called allopathic medicine, and it is about diagnosing and treating,
Okay.
You take some symptoms, you diagnose what it is, and then you treat either with drugs or pharmaceuticals or surgery or just acute interventions.
You're going to fix.
Right, we're going to fix it. This is what you have. Let's just fix it.
Right.
And you compare that to functional medicine, where it is an approach that attempts to get at the root cause of what is happening. Okay, so I'll give an example. If I may have a 35-year-old man who comes in and he says, my doctor told me I have high blood pressure, okay? And he wants to start me on a blood pressure medicine,
Okay.
okay? I would say, so that's the conventional route,
Right.
okay? High blood pressure, let's just start a medication. I would say, why does this 35-year-old guy have high blood pressure? Like, what is the cause of this?
What's happening in your world?
Right. What's happening in your world is happening in your body. Like,
Right.
what is there stress, which is inflammatory? Do you have, other forms of inflammation, sleep apnea, insufficient sleep, micronutrient deficiencies? So I really do try to find the reason for this high blood pressure and address those issues instead of starting the blood pressure medicine. So that's just an example of how, comparing a conventional approach versus a functional medicine approach.
Okay. So most of your clientele, you treat both men and women.
Correct.
Okay. So how do you assess and treat the root cause instead of the symptom? How do you assess it and how do you treat it?
Well, so it would depend. I mean, typically I start with a pretty comprehensive panel of labs.
Okay.
A lab test. So
Yes, I took it.
yes, you're familiar. And so
It is different.
it's different.
The things that you ask for us to go to the lab and, okay, first of all, it was a lot of vials.
Right.
Right, so I was sitting there for quite a long time, and I have great vein. I can just tap on there, and my vein pops. And I just sat there. I'm like, okay, are we done? No, she's checked this one and this one and this one. Okay, are we done? No, there's more. So you are very extensive in the things that you want to see.
I am. So in addition to the routine tests like, the cholesterol panel, Chem panel, CBC. I actually do typically advanced lipid panel testing, some vitamins, some inflammatory markers,
Okay.
and some other things as well. So yeah, so the first blood draw is pretty extensive, although it's still much less than donating a pint of blood. It just looks like it's more because there's a bunch of little vials. Okay, just want to.
Yeah, it's not. Yeah, we don't pass out.
Right.
As a matter of fact, I was talking to someone last week, and they said, I can do just about anything, but when it gets to drawing blood, I'm like, I go into tense mode and everything, and I even tell them, it's not going to work. It's not going to work. So actually, it's on my Instagram. I was sitting and I was doing the highlights on my hair, and I said, can I share something with you and how you can change your mindset and shift all that? She's like, yes. So I told her, you gotta let them do their work, because when you tell them they're not going to be able to, you're already freezing your own body, and you're freezing them doing the work that they are specialized in doing this. So stop freezing this energy, let it flow, and the blood will flow. Okay, I've got that tuned. That means we're going to go on a small little advertising break, and we will be right back. Stay tuned. This is Real Talk with Liza. The calls, the phone lines will be open. Please call in if you're interested. If you want to know more, by all means. This is a station. This is the talk that you can just ask just about anything. 866-870-5752. Is something weighing on your heart? A decision, a fear, or a challenge you can't shake? Let's talk about it, because your story matters. Join me Sundays at 10 p.m. for Real Talk with Liza, where we evoke, embrace, and evolve one conversation at a time. Our phone lines are open. Call in now at 866-870-5752, and let's have a conversation. Now back to Real Talk with Liza. I'll just call in with a question.
Oh, no.
Who's gonna call in? Like now. Who's gonna call in? No, I was your daughter.
She was asking if. No, I didn't even think to do that. They're probably in bed anyway, though.
Oh, already?
11. Like, yeah.
Come on.
9 o'clock that time.
I know. I'm in bed early too.
That's why she looks so.
Oh, we are back. This is so much. When you get three ladies talking about women's wellness and everything, and we go, actually right here, you can't see us if you are driving, if you're at home. I want to say thank you so much for tuning in. This is Liza Boubari from A Real Talk. You can find me on lizaboubari.com and also my website, Real Talk 870. Standing right here next to us is Christeil Gota. So she just came to wave for Facebook because we also do streamline this on Facebook. And then you can find us by tomorrow afternoon on YouTube. You can listen to us. You can watch us, everything. We want to make sure that I come to you with anything, any question that you have, because the answers are right here on AM 870. Okay, thank you. Dr. Speller.
Yes.
Let's talk woman to woman.
Okay.
All right. You work with so many women navigating menopause, hormonal changes, and aging. What are the most common complaints you hear in your practice?
So, first of all, I'll say that women, I think, are presenting earlier with perimenopausal symptoms than in the past. And so I'll see women, even 35-year-old women, who are coming in and they're having perimenopausal symptoms. It's actually
35?
right. So, but the symptoms at that age typically are, just fatigue, not able to sleep that well, very low libido, just exhaustion, lack of motivation. And so what happens is, because they are still menstruating regularly, perimenopause doesn't often come to mind.
Of course.
Okay, right? But in my extensive lab panel that I do check hormones very thoroughly and thyroid labs as well. And I'll often find that these women might have very low testosterone levels. And so their estrogen levels are fine and their progesterone levels are fine, but their testosterone is very low. And so testosterone replacement at that phase of their life can be very, very beneficial, could address all of those symptoms that I just mentioned.
Okay, because just today on Instagram I saw that Juliana Hugh, which is Derek Hugh's sister, she was doing the injections and everything, and to freeze her eggs.
Oh, okay.
Yeah, she wanted to do that. So why do you think so many women are still suffering in silence, going through this transition? Is it because they don't know what's going on in their body?
I think so. I think because perimenopause and menopause are so often associated with just not having a menstrual cycle, right?
Yeah. So usually we think after 48, 49, when we hit our 50s, that's when the menopausal signs come in.
Exactly. So it's just not, I think, as widely known that these symptoms can occur while you're still having a normal menstrual cycle. And I think for a lot of conventional physicians as well are probably not as aware as functional medicine physicians.
Working in the medical field as long as I did in my late 30s, early 40s, and then all the way through my 40s.
Yeah.
I was getting regular checkups because obviously you have to when you're working in the medical field, and all those conventional doctors said I was fine. I was fine, but all those same symptoms, fatigue, couldn't sleep. I didn't feel fine. Even up until, 3 months before I saw Dr. Speller. Got a blood test. Everything's fine. You're good. But I know I wasn't good.
Okay. Huh. So what is your perspective? Well, my question prior to that was, do you think, is it heredity? Like if mom started her menopause early, then it's easy, it's like a given the daughter goes through the same thing? Is it possible?
Well, I think that the age of one's mother really influences the age that a woman experiences menopause. But when we're talking about the perimenopausal symptoms, that's just a reflection of declining testosterone with age. I mean, for women, our testosterone tends to decline in our 20s. That's when the decline starts. And, for some, it declines more rapidly than for others.
And that has nothing to do with joy in your life or a happy life and happy partner, because
I'm sure those things contribute.
Okay.
Like for every condition. Right?
okay.
Yeah.
All right.
Right.
I just wanted to make sure that our listeners are not out there going into a panic. Oh my God, I'm 38 because I couldn't sleep or I can't function. I'm premenopausal. No, not
Right.
all the time.
Not always.
Okay.
And again, that's something that needs to be confirmed by labs.
Each person is different.
Each person is different.
Everyone's body is different. So what's your perspective on HRT or bioidentical hormones or natural options and everything?
Well, I'm a huge proponent of HRT.
Okay.
And
Would you also like to explain?
so I focus on bioidentical hormone replacement therapy. And bioidentical means that the testosterone or estrogen or progesterone that a man or a woman receives, because men get testosterone and women can get all three of those hormones, is identical to what your body produces naturally. Okay. As opposed to, for instance, you mentioned injections
Right.
of testosterone. The injectable form of testosterone is not bioidentical. It is actually either testosterone cypionate or testosterone enanthate or testosterone propionate. Okay, so these are forms of testosterone that have been created in laboratories that are testosterone-like. Okay.
Okay.
So
So it's not our body producing it?
no, our body does not produce that form of testosterone. Our body produces testosterone.
Okay.
Or
I
produces.
didn't know there was different levels of it.
Well, there's only one main type of testosterone that our body produces, and it's really just called testosterone.
Okay.
But the injections are testosterone, for instance, testosterone enanthate.
To elevate it?
No, that's just the name of
Oh,
the type.
got
It's
it.
a formulation
It's
of
a
testosterone,
formulation.
right? So it's slightly different than the testosterone that our bodies make. So that's why it's not bioidentical. Okay.
Interesting.
And again, progesterone is what our body makes,
Right.
and so if I'm going to give a woman progesterone, I will write a prescription for progesterone, not for progestin, okay, which is similar to progesterone. Yeah, so I'm a big proponent of bioidentical hormone replacement therapy. It helps keep us young, considered anti-aging, life-changing for many people.
So it's like a natural collagen?
Well, it's natural hormones. Our hormones, like I mentioned, testosterone starts to decline in our
Okay.
20s for women, and so by having our testosterone levels higher, that's a form of anti-aging.
What else can we do except the injections?
Well, so I don't offer injections for women because it's not bioidentical. I'll
Okay.
do either testosterone pellets,
Okay.
which are bioidentical, or
What is a
sometimes-
pellet?
A pellet is really just what it sounds like. It's a pellet of testosterone that is placed directly under the skin in the fatty area,
Okay.
and it just
Right around our
Yeah.
hip and buttocks.
exactly, or it can be the waistline as well, if that's
Okay.
preferable. Anywhere there's a good place a good pocket of fat. Okay,
Okay.
You can put it. And
To safeguard it.
Well, yeah, it needs to be subcutaneously inserted, and so that pellet just stays there, and it just slowly releases the hormones. So you don't have to worry about injections or pills every day or creams every day.
And the hormone goes throughout the entire body?
It does. It gets into the bloodstream and will go throughout the entire body. And the hormone is absorbed based on your cardiac output. So if someone is very, very active, they may absorb more of the testosterone from the pellets more rapidly than someone who, for instance, is more sedentary.
Okay. So how do you help women reconnect with we're going to that level, sexuality and sense of self during this phase of their life? Because I know we're becoming very graphic, but women suffer from, as you said, lack of sensuality, libido, vaginal dryness, and everything. I guess the tune is like, stay tuned. We are coming back, and if you have any questions,
Come back for vaginal dryness. You better come back. You're going to miss the vaginal dryness conversation.
yes, let's talk about sensuality in women and what turns us on and what turns us off. We'll be right back. This is Liza. You're live on Real Talk 870. Welcome back. This is Liza Boubari, and you are on Real Talk with Liza. We just went on commercial, and it was perfect timing because we are back, and let's not shy away from it because sexual wellness is health. And I believe when you have joy in the bedroom, joy within your body, you are healthier. Physically, mentally, emotionally, even spiritually. So what are some of the non-invasive treatments or therapies that you offer that help women reclaim their pleasure, vitality, and because it affects their confidence?
Well, like with any other health issue, problems with libido do not occur in a vacuum, right? So we need to, yeah. So we need to, again, we do the comprehensive assessment, make sure there are no vitamin deficiencies that we're dealing with, nutritional deficiencies, thyroid issues, and then we get to the point of hormonal balance, right? So we talked about low testosterone, and that is very commonly an issue for women who are experiencing low libido.
Okay, so how do we begin normalizing these kind of conversations?
Well, what I do for all my new patients, I have a questionnaire, and these questions are on the questionnaire because some people, they're coming to see me just for thyroid or for high blood pressure or something, and they don't know that they can also talk to me about sexual wellness. So by putting these issues on a questionnaire, they know that they could.
Yeah, my questionnaire for my clientele also has a lot to do with that. So why do you believe pleasure is part of healing? I know.
It's a part of being healthy.
Yeah.
Sexuality, pleasure is a part of being a healthy human being. And it does not have to disappear after the age of 35 or 40 or 50 or whenever women are starting to have perimenopausal symptoms.
Chris, do you want to chime in?
Chime in about
joy, body, healthy, because one of the things I hear it on the radio all the time. Working with especially women, I do see both men and women for hypnotherapy and stress management, and also being a domestic abuse consultant, dealing with weight and holding on with weight. It's holding on to a lot of guilt and shame and traumatic experiences. That's what I like to say. So our body holds a lot of that, okay? And then, yes, a lot of people can go and exercise, and still that emotional wellness is not well. Even the body looks good, but internally their self-esteem or negative self-talk is still there. And nowadays, it's the biggest thing, I think, in the last few years. Ozempic has become, and that's why so many of the, what is it called, Lendora's closing their doors, so many health and wellness that they were only Weight Watchers, some of them that were only about weight, Weight Watchers, that means keep watching your weight. They're closing their doors, and Ozempic has become the biggest thing. What do you believe about Ozempic or the natural ways of losing weight, and how good is it, or how much do we rely on that, and does that help?
Well, I think that Ozempic, which is semaglutide, or tirzepatide, this class of GLP-1 agonist, is really just a tremendous benefit. It's a tremendous medication. But it's not a panacea, right? I mean,
What is that?
It doesn't do everything.
Okay.
Okay, and it's also very expensive, so people can't be on it forever, right? So I do offer GLP-1 programs in my office, but it's a whole program. It's like they have to learn how to. So I tell the patients that GLP-1 is like a boost that can help them lose weight while they're making lifestyle modifications.
Okay.
Okay, so that includes learning how to eat more healthfully. That includes time-restricted eating, or intermittent fasting, as people call it, being more active, making sure they're getting enough sleep, making sure they don't have sleep apnea.
Is it true
Stress
that being on
management.
Ozempic that they had nausea, vomiting, and everything?
Well, those are very common side effects, but I find that
I think
those
any
are
medicine has a side effect.
potentially, and I think that those are mostly dose-related,
Okay.
and they're related to the speed at which the dose is increased. So I make it a point to start at a very low dose and to increase very slowly. And I often, or I should say, I very seldom increase to the dose that is recommended by the manufacturer. Okay, to the maximum dose.
So, Chris,
Yeah.
you've dropped a lot of weight.
I have.
You
52
know,
pounds.
52 pounds.
Yes.
How did that happen?
So through Dr. Speller's incredible help and guidance, and it was the very first thing we did was fix my insulin resistance, or my pre-diabetes.
Okay.
And we did that with some drastic lifestyle changes, which was cut out as many carbs as possible, especially my favorite carbs, rice and French fries. So
Mine
we-
is bread.
yeah, and bread. I cut out bread too. But it's all part of a program, and intermittent fasting. And I lost 12 pounds like within 10 days. It was very, very quick weight loss. And then after that, she said, just move your body, move it as much as possible. And she didn't even push me to do weightlifting or anything. But once I started that momentum, then I got motivated to lift weights. So now I lift weights. But I think the single most important change that is now like kind of my mainstay and keeping me at this weight loss is fixing my sleep. And I think that I never thought sleep was like any big deal. Like, I'll sleep later. I'll sleep.
So how
on the
many
weekend.
hours did you sleep before, and how many hours do you sleep now?
I think I never slept more than 3 hours straight, and I would wake up and not go back to sleep for 2 hours and then sleep for an hour. It was just, my sleep was terrible. And then when I prioritize sleep.
Are you talking about regular sleep or deep sleep?
Yeah, so I don't think I was deep sleeping at all,
Right.
Yeah, because, and so once I did the HRT, the pellets, and the weight loss, and then really prioritizing sleep, Dr. Speller said, just do what you can to, take the lights down, get off your phone, just do that, whatever, 30, 45 minutes, an hour that you need to settle down and get in that bed. And, as early as possible. So I started doing that, and it worked. And fixing my sleep fixed a lot of stuff.
Yeah, because when the body is in a calm state, in a dormant state, it goes into its own internal healing,
Yeah.
right?
Yeah.
Absolutely. And that's when we do most of our detoxification, is when we're
Right.
asleep. So if we're
Exactly.
not sleeping enough hours, we're not detoxifying properly.
Right.
Right?
So what is
Is
a
your-
good sleep? I think 7 to 8 hours.
7 to 9 hours.
9?
Mhm, 7
Wow.
to 9.
Wow.
And you also want to make sure that when you're sleeping, that you're actually getting restorative sleep, that you don't have, for instance, sleep apnea that's impeding that from happening.
Right.
So if you have a history of snoring or sort of waking up feeling like you're gasping, then it is really imperative to get a sleep study to make sure you don't have sleep apnea.
Yes,
Okay.
Dr. Speller ordered a sleep study for me, and I discovered I had sleep apnea. So and we fixed that with all the lifestyle changes.
Mm-hmm.
And going on the line of Ozempic, because you brought it up, you asked about, Chris, how'd you lose this weight right after you're talking about Ozempic?
Well, allow me to say this, because you have in the past dropped weight.
Yes.
And you gained it back.
Yes.
And I truly believe your lifestyle, your home style, the stresses in your life, stress creates a lot of that.
Mm-hmm.
So we hold stress in the body. But regulating it now with Dr. Speller, it's internal.
Mm-hmm.
So it was, you took care of the emotional and the mental, and this one is truly going in and working internally with your body.
Yeah.
So that's the integrative.
Yeah, and I still have the option, if I wanted to lose more than 52 pounds, if I wanted to go another 15 or 20 pounds, my option to do a microdose of Ozempic is still open to me. But
Okay.
at this point in my life, I really like the way my clothes fit on my body, and I want to try to build some muscle and lift more weights and
You
see
feel
where
more
it goes.
confident?
Totally, way more
Wonderful.
confident. But and also just I feel so much better in my body. I'm wearing pretty things at night, the way you told me like 5 years ago. Just wear pretty things at night and you'll feel better. But I never felt better in my my at my heaviest. But
Right.
now I dug out all my pretty things and I'm wearing them to bed now.
Awesome.
And I feel great.
You know, all this, because I work with self-confidence and self-esteem, anything that we do that releases stressors, releases tension, and brings joy and peace and calm and serenity in our life, we feel better anyhow. So,
Right.
I mean, anyone who comes to you, it's not only the body. I believe it's all starts in thoughts in the mind, and then it affects the body, and the body responds, and then the emotions kick in, and we start. It's like, why am I having an anxiety? I'm gonna die. Da 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 da. And then the words, our emotions kick in. So, perfect. Going back, yes.
I would like to remind Christeil, I don't know if you remember that one of the first tests that we did was to check your cortisol levels.
Yes.
And,
The saliva spitting test.
right, because Christeil, as you probably know, is a primary caregiver for 3 ill family members.
Exactly.
And
She's not taking care of herself.
Exactly. And
Was not.
was not. And her cortisol curve was depressed. And we talked about an adaptogen, I think cordyceps, for you, right?
Mm-hmm.
That was one of the very first things that we did. And I think that really within a couple of months, the weights just started coming off.
Yeah,
Between that and sleeping
Yeah.
and getting your hormones balanced.
Yes.
Beautiful.
Yeah.
Well,
All that.
we'll be right back. If you want to make a call, please, 866-870-5752. You have 3 specialists in here from the medical field, integrative field, and the emotional aspect. Mind, body, emotions, we're all here. And Christeil also dabs into the spiritual and energy and all that. We'll be right back. Is something weighing on your heart? A decision, a fear, or a challenge you can't shake? Let's talk about it, because your story matters. Join me Sundays at 10 p.m. for Real Talk with Liza, where we evoke, embrace, and evolve one conversation at a time. Our phone lines are open. Call in now at 866-870-5752, and let's have a conversation. Now back to Real Talk with Liza. Well, welcome back. This is Liza, and I am here with Dr. Speller, Dr. Cristal Speller, Christeil Gota, and Liza Boubari. It was like Christeil, Cristal. So we're talking about wellness, integrative wellness, and women's wellness, menopausal, sleep, weight, everything. One of my programs for 9 weeks is how to drop weight. Because I believe there is power in the words that we use. When we say losing, it's a loss. And psychologically, the subconscious hears loss. And anything we lose, what do? We're constantly looking for it, and we're going to bring it back no matter what. So we call it let it go, release it, or just drop it. Because when you let it go, you're in charge. There is no loss. There is no grieving.
Interesting.
It's the emotional connections because someone can be very thin and still in their mind feel not good enough, I'm overweight, I look ugly, nothing fits me, because it's all in it's a psychosomatic, right? When I went to my regular doctor, talking about, we're getting graphic again, sensuality, at a certain age, after 60, we're talking about the vaginal dryness, especially when you're not having a partner every night or even often enough. And he said, you can use just a cream.
Yeah.
Thank you. You treat it in a different way.
Well, it would depend. If it's a patient who wants the pellets, we talked about the
Right.
testosterone pellet, there's also an estrogen pellet.
Okay.
So I can place them at the same time, and that
It increases.
estrogen goes throughout the body.
Okay.
And will increase your overall body estrogen, and estrogen is very important for maintaining normal lubrication of the vagina.
And doesn't it affect other parts of the body? Because I was told that too much estrogen is not also healthy.
Right, so too much estrogen is not healthy, so
Right.
you have to make sure you have the right amount. So
Okay.
I always, I prescribe estrogen very conservatively, and I also balance it with the progesterone. So you don't want unopposed estrogen. If someone's on estrogen replacement therapy, you want to balance it with progesterone to avoid those issues. And probably most importantly, you want to make sure it's bioidentical.
Okay. So what is the one myth about menopause that we can bust?
Well, I would say that it's just the way it is. It's just a part of life.
Pausing.
And this is it. I mean, this is it. Just like
It's part of the beauty of womanhood.
Yeah.
You know, last week I was talking about something that happened, and in UK, it went all the way to Supreme Court of the definition of a woman.
Yes. I heard about that.
Right?
Right.
I was baffled that certain people, especially, they sit and they want to decide what's a woman. I think we either have it or we don't have it, right? And if you bleed every month,
It seems pretty straightforward. Doesn't it?
exactly.
Right.
I know it's not about conception of a baby, because not every single woman can conceive, but it is the ability of birthing. But we, from the age of 11 and 12, we go through this cycle every month. And then after a certain age, that cycle changes and the body says, give me a break. Now I'm going to do something else. I'm going to another transition. So
Exactly.
I think the most beautiful thing to our body that happens to our body is this transitional stuff. I mean, from baby to childhood, and then teenage years, and then adulthood, and then seniorhood. You know, all these hoods. So what is your favorite daily wellness ritual for you? What is yours?
Well, I'll have to tell you, I have to admit, I'm struggling a little bit right now with getting enough sleep. And so,
I have audio recordings that it is for deep sleep, and it taps into the subconscious and allows you to sleep.
So what my goal is, what I'm working on, is just getting enough sleep, because when I get enough sleep, I wake up without an alarm, and I love that, just waking up without an alarm, refreshed.
Yeah. You have a family, husband, children?
3 children.
3?
Husband, yes.
Awesome.
3 girls.
3 girls.
Lots of estrogen in my household.
I knew someone who said not only they had 4 daughters, the wife, and then the mother-in-law was living with them. And
Lots
he
of
says,
estrogen, yeah.
we brought dogs, and I made sure one of the dogs was a male.
Well, that's fine. My husband would probably wishes that would happen, because I have, also my mother lives with us. And
See, I was close.
We have 3 female dogs and a female cat.
Oh my gosh. Okay.
Wow.
He must be in heaven.
He's multiply blessed.
Yes.
That's right.
Very much so. What do you do to say to women who feel like they feel lost? Because I work with women who come and say, I want peace. I don't have peace, especially in DV situations, abusive situations, and it's just like, it's too much for them. But one of the things is like functional freeze. What do you say to women? Especially working, functioning, not getting enough sleep.
What I would say is to not feel afraid to let people know what you're going through, and to really just, and to understand that if you're going through something, then there are definitely plenty of other people who are going through it and who can offer support. I think just not being ashamed of how you're feeling and discussing how you're feeling is
Express.
Right.
Yes.
Instead of suppress.
Yes.
Right.
Especially in the throat area, thyroids and everything, and coughing. I usually say express what you have been suppressing, and that means verbally. What gives you the most joy in your practice?
Well, Christeil is an
I know.
example
I mean,
of
it's
what gives
just
me
like-
the most joy. And also her sister. I mean, both she and her sister have, I think, had tremendous progress in my practice. And
Yes.
it's
Do you want
really
to talk
gratifying.
about that? Because I would
Yeah.
love for you
Oh,
to
yes.
talk about her.
Yes, she has stage 3 breast cancer.
Yes.
She's receiving conventional chemotherapy, but also holistic and functional health from Dr. Speller. So
Okay.
she's receiving MAH or ozone therapy and high dose vitamin C. And
you come
very
from
strict-
the cancer.
Yes.
Okay.
And this is
You
absolutely.
were the CEO of LA Cancer Network.
Yes,
Let's
yes.
make sure that, and Hawaii
Yes,
Cancer
I
Network.
worked in conventional cancer
Right.
care for 15 years, and it's not enough. And so when my own family member came down with this cancer, I went out to functional medicine and found Dr. Speller and immediately put her on complementary therapies. And she is thriving. She's almost at remission, and tumor's almost gone. She
Amen to that
Yeah,
one.
all her hair grew back, and she's energetic and healthy and healthy and healthy and happy.
Awesome. This is beautiful.
Yeah.
She's such a sweet soul.
She is.
Yes.
She is. So.
Well, I want to say thank you. This has been enlightening. So for many, we're going to put your. Would you like to share your website? I'm going to put all that information and
Sure.
yeah.
So my website is glendalewholehealth.com.
Beautiful. We'll have all the information there, and if you go to Dr. Speller and you say you came to her because you heard it on Liza Real Talk with Liza, you'll probably get a 20% off of the services that is being offered. I always have a quote, and the quote is, "Communities and countries, and ultimately the world, are only as strong as the health of their women."
Love
that.
it.
Isn't
Love
that?
it.
Wonderful.
It was by Michelle Obama.
Oh, wonderful.
Yes. So
Excellent.
I want to say thank you, Christeil and Chris Gota, my friend, and Dr. Speller. And tonight's talk stirred something in you. If that has happened, if you're tired of just coping and are ready to reclaim your clarity, you want to release a lot of the emotional, physical, and mental weight that has been weighing down on you, give me a call. Real Talk with Liza or lizaboubari.com. You can go to my website. We also have other tools and techniques for you. Until next week, I want to say thank you, God bless you, and have a wonderful evening. May God bless you and universal light surround you always. Good night.
This program was sponsored by Liza Boubari and